everyone. I'm Haley Hansen. I'm a partner at Husch Blackwell and the leader of the education group. Before we begin, I'd like to cover a few housekeeping items. At the bottom of your audience console, there are multiple application icons for your use during the program today. If you have any questions during the webinar, please submit it via the question box. We will try to answer all the questions we can, but we do have a lot of content for you today. So if a fuller answer is needed or we run out of time, we'll follow up with you via email later. Also, a PDF of today's presentation is located in the resources folder. So if you click on that folder, you can download the presentation. The program has been approved for continuing legal education credit. So if you want to report your CLE hours, you can click on the CEU icon at the bottom of the screen. A certificate of attendance, including the course numbers, will be emailed to you tomorrow, along with the recording of the webinar for viewing and sharing at your institution. Toward the end of the program, be sure to complete our survey. It's very short, and we just ask for feedback on future programs that may be applicable to your institution. That's it for the housekeeping items, so let's go ahead and get started with the program. Joining me today is Ellen Armentrout. Prior to joining Husch Blackwell, Ellen worked for 15 years as an attorney in the General Counsel's Office at Michigan State University. During much of her tenure, she worked very closely with academic and administrative units the university on complex compliance issues, frequently involving matters of great sensitivity. Ellen also, her practice currently consists of working in the areas of compliance, including Clery, Title IX, and the Violence Against Women Act. So Ellen, welcome, and I'm glad that you are joining me today. All right, so let's go ahead and look at our agenda for today. So we are going to do, we're going to go through several things. First of all, our Clery compliance overview, specifically as we look at hospitals and academic medical centers, and really looking at some of the changes that have happened since October 9th of 2020, and what does that mean for your institution. And then Ellen is going to take a look at Clery geography and really narrow in on what has changed regarding geography, some considerations and best practices. I'm going to talk about campus security authorities and how to address campus security authorities. Then we're going to also discuss confidentiality concerns and what we see as we look ahead. All right, so let's start setting the stage of our overview today and really talk about what we're seeing when it comes to Clery. So as you know, the Clery handbook was kind of our guiding light. It was published. It replaced the old handbook in 2016, had lots and lots of information, examples, but it was always non-binding guidance. This was just sub-regulatory guidance, so it did not go through the regulatory process and had no force and effect of law, although the handbook was really used when a Clery audit would occur by the auditors to look back as to whether or not an institution was in compliance with Clery. So we really relied on the handbook, but as of October 9th of 2020, it was rescinded. It was put out through an electronic announcement that was 5 pages that really added an appendix to the Federal Student Aid Handbook. And so the appendix is 13 pages in length, and it says that this is rescinding the handbook and replacing it, and so a full replacement of the handbook. So a lot of you already know that this is happening or has happened. So there's been a lot of questions because obviously when you replace 265 pages with 13, there are some unanswered questions that have occurred. So we're going to try to walk through kind of what we know, and we are anticipating, honestly, from the new administration, from the Biden administration, that we will see a new handbook. Now, I will tell you that you should take that with a grain of salt, because I was telling individuals that the new Title IX regulations were going to come out about a year before they actually came out. So I'm not sure how quickly you will see a new handbook, but what we've heard from our contacts in D.C. is that a new handbook is in the works. So we will be waiting for that. So a lot of people have asked about the effective dates. What do we do now that the handbook has been rescinded and that the department is, really under the appendix and electronic announcement really focused on not only the statutory guidance but also the Clery regulations and the vowel regulations, and really going back to that that language within the regulations. But as you know, if you practice in Clery, there's a lot that is included within the ASR that isn't spelled out for you in those regulations. So the effective date, the handbook is rescinded, and it was rescinded effective immediately, but will still be a safe harbor. And so that was, something that was important to put out, and that was perfectly acceptable to rely on its provisions for your 2021 ASR. And again, the department has recognized that people have become very accustomed to using the handbook as well, which is likely why we will probably see a new one. So, but the appendix is in effect for this reporting year, so we'll kind of go through and talk a little bit about where you can see differences or changes as you're moving forward. So that really kind of sets the stage then for what does this really mean. The department in October of 2020, prior to the election, really talked about having less rigidity, making this more flexible, making it up to the institution. But if a lot of these choices are going to be up to the institution, documentation is going to be so important, because what we've seen this year with the Biden administration is a lot of spot checks for a lot of schools, specifically related to news events. So something that has been reported in the news, we've seen the department reach out and do a spot check on that particular incident and what happened during that incident, but then in the meantime ask for a lot of other information and data surrounding that incident. So we're really looking at, how, as we look at medical center, affiliations, as we look at a lot of other kind of issues, when Ellen's going to walk us through geography, you really need to make you're documenting all of your decision-making and how you got to that decision-making. And any time you can tie it back to the regulations, that's going to be your best grounds if you get audited. And so really think about that as you're looking at making decisions regarding geography or even CSAs or other different decision points. Tie that back into the plain language of the regulations, and that be a safeguard for you as well. All right, so as you know, some things have stayed the same. I mean, obviously, the annual security report, Clery crimes, none of those things have changed. CSAs, you're still responsible for identifying and making sure that CSAs understand their responsibilities, but there's going to be some nuances now with the changes that have occurred as well. So, Ellen, I'm going to turn it over to you to really hone in on geography specifically for hospitals and medical centers.
Great. Thanks, Haley, and thanks, everybody, for coming today. So I think we all know that Clery geography can be a sticking point even under the best of circumstances. And with the limited guidance that we now have, like Haley said, we're going to be focusing a lot more on the statute itself and the regulations. So the new appendix stresses, that was one of the motivators, was to get people back to the statute and the regulations, which are cited here. The department determined that too much information is just as detrimental as too little, and then when in doubt, you should apply the plain meaning of the regulatory and statutory requirements. The appendix, as we know, doesn't provide nearly the level of detail that the handbook did. So for better or for worse, this allows us or requires us, as the case may be, to rely more heavily on the primary documentation, the regulatory, the regulations and the statute itself. So let's talk about the different types of Clery geography that we have. As you all know, we've got campus property, non-campus buildings and property, and public property. So the Clery handbook went into great detail with lots of examples about Clery geography. Some people found the examples helpful, some people found them overwhelming, some people found them overreaching. The appendix, however, doesn't add much to the existing regulations. So let's talk a little bit about the similarities and differences first between campus and non-campus buildings and property. So campus property is property that your institution owns or controls that's reasonably contiguous to your institution. So the same reasonably contiguous geographic area, and the property is used in direct support of or in a manner related to the institution's educational purposes. Then you've got non-campus property, which same first step, your institution owns or controls the property. A difference is that non-campus property is not reasonably contiguous to the main campus. We find that this comes up a lot in the context of hospitals and academic medical centers, or even universities that just work with medical facilities around their town or in other towns. So this is going to come up a lot in the context that we're talking about today. What does it mean to be reasonably contiguous? And we're going to talk about that a little bit later on. Property is used in direct support of or in a manner related to the institution's educational purposes and is frequently used by students. So that's a difference. Non-campus property needs to be frequently used by students. The Clery handbook talked a good bit about separate campuses and what constitutes a separate campus. The appendix simply says if an additional location, branch campus, school within the institution, or administrative location is not within a reasonably contiguous area, such a location would be considered a separate campus for reporting purposes. So we'll talk about that a little bit in one of our scenarios later on, but that's the guidance we have at this point regarding separate campuses. That comes up in the context of when you have, say, a unit within your university that resides in a separate location. You need to be thinking about whether that would be non-campus property or a separate campus. Then we also have the definition of public property. The statute defines public property as property within the same reasonably contiguous geographic area of the institution, such as a sidewalk, street, thoroughfare, parking facility that is adjacent to the facility owned or controlled by the institution if the facility is used by the institution in direct support of or in a manner related to the institution's educational purposes. We see language here that's mirrored from the earlier language we saw with regard to the definitions of campus and non-campus property. The regulations add that the public property is accessible from the campus. The handbook talked a lot about what that meant. The appendix in that regard is silent. But if you've got other campuses other than your main campus, say you've got a medical school that's located across town or a school of physical therapy that's 4 miles away, you need to be thinking about the public property at those locations in addition to your main campus. So let's talk a little bit about Clery geography in Title IX. We've had a lot of changes going on recently, and we always need to be thinking about these overlapping compliance obligations that we've got. And I say they're overlapping, but they are not necessarily identical. So the Title IX regulations extend to the institution's education program or activity. That might be different from your Clery geography. So looking at your Title IX geography, you need to be thinking of the location of the event or circumstance in which the alleged conduct occurred. So say you've got, a group of students who are gathering at a hospital common room because they're on a break from their clinical rounds. You might not have, the common area might not be a part of your Clery geography, but if there was a Title IX event that took place there, you'd need to be looking at that location in addition to what was happening there. Why were the students there, to determine whether it might be Title IX reportable. So the result is that you may be initiating a Title IX sexual harassment grievance procedure without accompanying Clery reporting. So we need to make sure that we don't conflate those things when we're looking at what's reportable and what the obligations of the institution are. So let's talk about some of the changes that have affected Clery geography that we're going to have to be thinking about as we look at medical centers, hospitals, student health. So the appendix eliminates the definition of owned or controlled by. The handbook had a lot of talk about space agreements versus program agreements, shared governance, all kinds of things that gave us some guidance when we were talking about what constitutes Clery geography. As Haley mentioned earlier, without that, we've got to go back to the regulations, back to our best understanding of the regulations and the statute, and documenting our decisions. The appendix also eliminated the definition of directly supports. So we need to be thinking about what that means just on a plain language basis as we look at our geography. Again, the appendix eliminated any specific or measurable distance definition regarding reasonably contiguous. So the handbook had said within 1 mile was sort of a good rule to follow when you were thinking about something being reasonably contiguous. We don't have that definition anymore. So again, we just need to be using our best judgment, documenting our decisions. Now, separate campus, I talked about this a little bit earlier. The statute says an institution must comply with the requirements of this section for each separate campus. Again, the appendix says an additional location, branch campus, school within the institution, or administrative location not within a reasonably contiguous area may be a separate campus for reporting purposes. So again, lots of judgment on the part of these institutions with regard to what needs to be reported. So this is some general language about geography. While the Clery handbook gave us lots of examples involving medical centers and hospitals, the appendix is silent. So let's talk a little bit about medical facilities and what an institution's responsibilities are with regard to them. So first, let's talk about student health. Not a lot of mystery here, fortunately. Student health centers are generally going to be on campus, and therefore Clery crimes that take place at a student health center is going to be reported as having taken place on campus property. If for some reason your school does not have a health facility or refers a student to a specialist at a hospital that you don't have any relationship with, any incidents that take place with your students at a health facility not affiliated with the campus do not need to be reported in the ASR, even though they may involve your students or your employees. So fortunately, student health centers generally pretty straightforward when it comes to Clery compliance. Things get a little stickier, however, when we're talking about affiliated medical centers. So let's start with our first scenario, and you all are going to get to vote on this. So the scenario is a private nursing school has an agreement with an outpatient surgical facility across town to send nursing students to the surgical facility for clinical training. As part of their training, students are required to listen to patients' heartbeats. While nursing student A is listening to a particular patient's heartbeat, the patient gropes her breast. Is this a Clery reportable incident? So you all have the opportunity to vote here. Again, this is a nursing student. There's an agreement between the school and the surgical facility across town to send nursing students there for their clinical training. As part of the training, a student was listening to a patient's heartbeat, and while she was doing so, the patient groped her breast. Is this Clery reportable? Let's see. Okay, so we're split a little bit down the middle. 55.5 say yes, this should be reported as fondling. 44.5% says no, the incident did not take place on Clery geography. I think the question that we're talking about here is whether the school has ownership or control of the facility where the incident took place. I would argue that this did not take place on Clery geography. The facility was not reasonably contiguous to the main campus because it was across town. It is used in support of the institution's educational purposes, but the institution does not have ownership or control of the property. In this instance, the agreement is for the between the institution and the facility allows patients to do their clinical work at the facility. There is no lease agreement between the two entities. I cite a lease agreement because in the handbook itself, I'm sorry, not the handbook, the Clery handbook gave us great detail about ownership and control, but the appendix says when it's describing a non-campus property that the property must be owned or controlled by an institution. And then it includes a parenthetical that says, e.g., leased by the institution. This suggests to me that the appendix is sort of picking up from the Clery handbook where you have a space agreement. There is ownership and control. But we would continue to say that if there is no agreement for the use of the space, barring anything else, this would not be considered the institution's Clery geography. All right, we have another scenario here. The university has a physical therapy program. And as part of the program, the students are trained by physical therapists at a facility 5 miles away owned by a private contractor. The university has a written agreement with the contractor to use a classroom on the 4th floor free of charge from 5 to 8 p.m. every evening. I should specify the classroom is used to hold classes for the school. While a student is in a therapy room on the 1st floor experimenting with a piece of equipment on his own, someone comes into the room and steals the student's wallet from him at gunpoint. That same perpetrator then goes into the classroom, sorry, I should have said on the 4th floor, not the 2nd, on the 4th floor, while class is in session, brandishing his weapon and steals a student's laptop. Are both incidents reportable? This is another one where you all are going to get to vote. So, are both incidents of robbery reportable? Both the one where the student is in the equipment room, checking things out on his own, and he gets robbed at gunpoint? Is it 2 incidents of robbery are reported? Is the incident that occurred in the equipment room reported, but not the incident from the classroom? Is the incident that occurred in the classroom reported, but not the incident in the equipment room? Or is neither incident reported? And just as a reminder, the first incident took place in the physical therapy equipment room. The second incident took place in the 4th floor classroom that was leased by the institution for classroom purposes. Okay, we've got a healthy number of people saying 2 incidents reported, very few saying the equipment room incidents reported. We've got the majority, 68.7%, saying that the classroom incident is reported, but not the incident from the equipment room, and we've got a couple people saying that neither incident is reported. I agree with the majority of the people who filled out the poll. My advice would be that the incident that occurred in the equipment room did not take place on Clery geography because there was no ownership or control of the equipment room. A student had just wandered down there to check out the equipment on his own. The incident that occurred in the classroom, I would argue, took place on non-campus property. The classroom was not reasonably contiguous to the campus. It was, I think we said, several miles away. It It was used in a manner related to the institution's educational purposes because it was used as a classroom, frequently used by students. They were there 5 nights a week from 5 to 8. And there was an agreement between the center and the institution for the use of space, which is evidence of ownership control, and that is supported by the language in the appendix itself. All right, so we're getting our full share of scenarios today, but I think the scenarios are helpful because of the silence of the appendix, and so we use these as a way to think through these issues that may present themselves. So, an institution has a medical school situated within a hospital approximately 3 miles from the main campus. The institution rents the entire 3rd floor of the hospital for institutional use, and the bulk of the medical school classes take place there, and all the employees report to work there. The medical school registrar is attacked with a crowbar on her way to her car in the public parking lot outside of the hospital one Tuesday evening after work. Is this incident reportable for Clery purposes? So your choices are yes, this is a reportable aggravated assault, or no, this incident is not reportable because it did not take place on the institution's Clery geography. So the incident took place in a public parking facility outside the hospital, the 3rd floor of which is used by to house the medical school of a particular institution. So yes, this is a reportable aggravated assault, or no, it's not reportable because it didn't take place on the institution's Clery geography. Let's see what people said. We got 73% of people saying this is a reportable aggravated assault. We've got 26.9% of the people saying that it did not take place on the Clery geography. I am in the camp of the majority here. I would argue that this incident is in fact reportable and that it took place on the institution's public property. I think the 3rd floor of the hospital is likely considered a branch campus for Clery purposes. I say that because all of the employees report there and it's where the students take most of their classes. It seems to be independently operated there, and independently might be too strong a word, but it is a self-contained entity of the school there, in which case the parking lot is public property because it's adjacent to a facility owned or controlled by the institution and used in direct support of the institution's educational purposes. So I can see how people would think, you know, maybe not because the building itself might be owned by the hospital, but I think it would be considered a branch campus, in which case the public property would be considered part of the institution's Clery reportable property. A separate campus has reporting obligations for its public property. So we've got another scenario here. A university and its affiliated hospital sit on the same city block. Many of the university medical school faculty also work at the hospital, and the two institutions share a handful of board members. Students from the medical school undergo clinical training at the hospital pursuant to an unwritten understanding between the institutions. A university student, while undergoing clinical training at the hospital, sexually assaults a patient. Does the university have an obligation to report this incident under Clery? Go to the answer. The choices are yes, there is an obligation to report under Clery, no, there is not, or help, because this is hard and we don't know. So again, the hospital and university sit on the same city block. The hospital and university share many faculty and a handful of board members. There is an unwritten understanding between the two entities that medical students will undergo clinical training at the hospital. a university student while they are sexually assaults a patient. Is it reportable under Clery? Most people, we've got 59.8% saying yes, we've got 21.4% saying no, and 18.8% saying help, which I totally understand. In this situation, I would go again with the majority, and I would say yes, that this is reportable. And let's go through why. The question is the hospital campus property? It's reasonably contiguous. I would say sharing the same city block would mean that you were reasonably contiguous, even though we don't actually have a definition for reasonably contiguous. But I think that level of closeness and that level of the implication is certainly shared space. The question is it owned or controlled by the institution? I mean, it's clearly used for indirect support of the institution's educational purposes. And even if it's controlled by another person, if it's owned by the institution, it is frequently used by students. So we think in this situation the best answer is because the appendix is silent on this in terms of what constitutes ownership and control, and because the Clery handbook is still considered a safe harbor, we would recommend reporting this incident on the theory that the relationship between the university and hospital exhibits some level of control by the university. We would say, we would really stress that this is something that should be documented. The Clery handbook said beyond formal legal arrangements, other factors considered in determining whether there is ownership or control is overlapping faculty and doctors, overlapping board of directors, use of the hospital or medical center as part of the institution's educational program, geographic proximity, and the ongoing relationship between the institution and the hospital. So taking the department at its word and using the handbook as a safe harbor, we would recommend going ahead and reporting this incident in your ASR. Next question is, would this be reportable under Title IX? Yes, it's clearly sexual harassment. It is within the university's education program or activities. It was committed by a student. I think there's some question about what would you do if the situation were one where the patient had sexually assaulted the student. In that case, it's likely that if the patient wasn't affiliated in with the university, that if the university would not be considered to have control over the patient, and maybe then if the patient were the victim, if the patient were the perpetrator, you would perhaps not have an obligation to look at this under Title IX. So let's talk about some decision points on geography. Certainly the best practice is to have a map outlining your campus geography, and that would include separate campuses, non-campus property, and public property. It's also key to understand the relationship that the institution has with hospitals, medical centers, any affiliated medical facility. Is the agreement for the use of space? Is the agreement for just a program? How often? How many students? What does it entail? Those are all really important pieces of information to have documented. Then document why you made the determinations of whether a piece of property or a building is a separate campus or a non-campus property. Analyze the specific facts that are presented with each situation. And then when you've made a decision regarding whether or not something should be included, you should document that decision as well. So now I'm going to switch it back over to Haley to talk a little bit about campus security authorities.
Thanks, Ellen. And we did get a number of questions that came in during your Clery presentation, so we'll try to get to those at the end. One of the questions that came in, though, I just want to kind of answer, and that is a couple of things. Lots of people rely on the help desk, the Clery help desk, to get information and to determine when you're going to report something and when you're not. And I'll be honest, there's been some inconsistency amongst our schools regarding the help desk answers that people have gotten. For example, with a closure of a particular campus, the help desk gave two different schools different answers. Now, they had a little bit of difference, but they seemed inconsistent, honestly. And so I don't think that happens very often. I think the help desk is a really good resource for you to call, but they're not going to be able to answer all of your questions. And my recommendation is to document when you actually are calling the help desk as well, and try to get some documentation of an email or email response that you can keep in your files of how you made that determination, especially if you're relying on guidance provided from the help desk. So I just wanted to talk about that. And then another question that came in, Ellen, during your presentation was, if the handbook, if the appendix doesn't address this because it's 13 pages, address the particular situation, but the handbook does, then wouldn't we be okay to rely on the handbook that gives more information? And again, the handbook has been listed as a safe harbor. I think what we're really trying to say is you need to think through the rationale for why you're making the decisions that you are and really have documentation. When it comes to a Clery audit, and a lot of our clients have been through them, the list of documents that you would get right off the bat from the department is very, very long, and wants things that are not necessarily documentation included within the ASR. And so if there's something like this that is, something that's in a gray area, and you've gotten help from either outside counsel that or your internal GC's office, or you have called the help desk and you've actually gotten assistance from the department, make sure you're documenting all of that and that you're keeping it together as you go through, because I do think that there is going to be a safe harbor then, and you can rely on that. I've just been surprised, since we're in the unique position of getting to work with lots of different schools, that on what are very similar questions, we've gotten a different response at times. Now, they've been a couple years apart, too, so there's different people who work at the department as well. But just document it, because if you're relying on that answer and all you have is, well, I called the help desk and this is what they told me, so this is what I did, that's not going to get you very far versus documentation. So, and Ellen, I'll let you go through the rest of the questions kind of while I'm doing this and doing the Campus Security Authority piece, and then we'll get back to questions towards the end. So when you talk about Campus Security Authority, CSAs, nothing changed in terms of the regulations regarding CSAs, and that is reflected not only within the appendix itself, that the regulation is actually cited, but also within the announcement, the electronic announcement that came out regarding CSAs. And so I've just pulled out exactly what the regulation talks about of how to identify CSAs. And really the first three are kind of no-brainers for institutions, that those categories are going to be CSAs. So we won't spend a lot of time going through them, but obviously your campus police, your security departments, individuals with responsibility for security and policing, any organization that's doing those jobs on your campus is going to be a CSA, and that's pretty easy for institutions. Where we find difficulty is really this fourth category when you talk about a CSA, that it's an official of an institution who has significant responsibility for student and campus activities, including but not limited to housing, student housing, discipline, and judicial proceedings. And this is where we saw the department in October of this year really come out and say that they were going to strictly adhere to the definition that was included within the regulations, and that specifically in the electronic announcement, it goes on to state that the 2016 edition of the handbook expanded the definition of CSAs to include individuals that should likely not be designated. And so really looking at is saying that there should be a more strict interpretation of Category 4. So again, there's a safe harbor if you're using the handbook, because the handbook is really an expanded definition. But as the appendix goes into effect and we see the appendix, we're really going back to what is included, and a key word is going to be that an individual has significant responsibility. And so I think it's important as you look at this that, number one, the department says very clearly, and this is on page 3 of the appendix, that the department will defer to the institution's designations of CSAs, and provide technical assistance when necessary to make sure that there's proper identification. So, you get to decide who is your CSA, and we've had a lot of, as long as they fall within one of those 4 categories that we just talked about within the regulation, that's where we are right now. There's a more strict interpretation. Some of our schools are saying we're just going to stick with what we've been doing. We want people to report. We want to encourage reporting. We're going to have individuals report as CSAs. Others have actually taken this time and started to look at their CSA designations and have a more strict definition, because it had become so expansive where there were hundreds, if not thousands, upon big campuses of CSAs that were identified. So it's up to the institution. Again, the department under the appendix, until the appendix is replaced, and who knows when that may be, will defer, again, it's in writing, to the institution's designations as authoritative in who is going to be identified as a CSA. So I think a couple of things that you want to really focus on when you are deciding whether or not you're going to go through your CSAs is really to look at, and I'm going to go through this scenario, but look at this definition of regular and significant interaction, and how do you identify regular and significant interaction with students to identify them as a CSA. And one of the things that I think would be helpful for you is to create, and it can be as easy as a spreadsheet, but a spreadsheet of your CSAs, and then how you could have a column for the regular and significant interaction with students or student groups, those types of things. So essentially what the department is telling you is, under the handbook, the CSAs could have been interpreted to use a faculty member who was worked with a student organization, was the faculty rep for the student organization. That person would be a CSA. Under this stricter interpretation, that person would not be a CSA. All right, so let's talk about one scenario. A security guard at a hospital where university medical students take classes and do their clinical training reports to the medical school administrator, who sits on site at the hospital, that he saw medical student A slap her boyfriend across the face as they were walking past to their classroom. What should the medical school administrator do in this particular situation? All right, so I will launch this poll. So the answers are: confront medical student A and ask her what happened, document the report, or document the report and provide it to campus police and security. So as a CSA, what should they do? So I'll give you just a couple seconds to respond. All right, so, we got 100% right. That's wonderful. This is our easiest one scenario of the day, so that's good. So everyone agrees. Document and report it, that this is going to be a campus security authority. And so making sure that information gets to, not only is documented, but gets to the police or security is going to be extremely important. All right, so let's talk about some of your kind of decision points or best practices when it comes to CSAs. So really, I think, designating an individual who is going to coordinate overseeing CSAs. What we see, especially when we have schools that are going through the audit process with the department, is that there's not a central individual who is really making sure that the CSA lists are being updated and updated more than once a year. So, that you're sending out those lists and making sure, do you have employment changes, that people have left employment, that we need to update the list, that someone is no longer a CSA. Making sure you have accurate lists is going to be very important. Also, make sure that if you have separate campuses that you have identified CSAs on those separate campuses, at least one CSA. Make sure that the CSAs know that they have been designated. That's going to be important. So usually in the audits, what we've seen, and really good documentation for the audit trail, can be an email that's pushed out to the CSAs. So just do a mail merge or whatever you need to do with your spreadsheet to send out a reminder, not only of the fact that they're a CSA, but what they need to do to report, and what is your reporting system, how does that work, and just basic information about their obligation to report. And then what the department likes to see, or has liked to see in some of these audits that we've been involved in, is that you've confirmed with your CSAs that they have made all their reports, especially at the end of semesters or at the end of the school year, that you're having some confirmation that those reports have actually been made. So all of that can kind of be pushed out. We think it's a best practice to do some training for CSAs. It's been wildly contested in various reviews or audits. The handbook was inconsistent on it. The department in some audits of some schools were very harsh prior to this new appendix and said that if you didn't train, how could you ensure that that you had accurate reporting, because you didn't have any documentation to show that there was accurate reporting. And so that's why sending that follow-up email to CSAs confirming that they've reported everything that they are supposed to report can be really helpful documentation if you get into an audit as well. It is not required to train your CSAs. Let me be crystal clear. The regulations do not have anything that requires you to train your CSAs, but somehow you've got to get that information to them of what is your reporting mechanism, what things do they need to report, the fact that they have been designated a CSA, because that's kind of the worst case scenario is somebody comes in for an interview with an auditor and they weren't even sure they were designated as a CSA. And then make sure, again, that you have, that if there's questions or information, tell people we'd rather have them report than not report. I think we want them to err on the side of reporting and to keep that documentation. And specifically during the audit trail, for those of you who've been through a Clery audit, you know this, but they actually ask you, how many of these reports came through your CSAs, and so making sure that you can identify the reports that come directly from your CSAs. So I think that's really important, as well as you look at best practices, whether or not you're going to go back through and identify again CSAs and kind of have this more strict definition, because the appendix specifically says that if a individual has irregularly scheduled duties or duties that are not part of their primary job, they're not going to be considered to be a CSA. So it's got to be significant and regular when you look at that definition. So keep that in mind. Again, it's something that a lot of schools are kind of struggling with, of how they want to approach this, and I'm sure it seems to be an ever-changing guidance from the department, so there may be new guidance that is coming. One of the questions, and I may have already answered this, but I'll just answer it again, is we don't anticipate any guidance coming from the department that would change your ASR to be posted October 1st of 2021. And so far, we've heard no rumblings, although we could be wrong, but we've heard nothing from the department that they would extend the deadline this year for the reporting or for posting your ASR on or before October 1st. So with that, Ellen, I will turn it back over to you to talk about confidentiality concerns.
Great. Thanks, Haley. So I think a lot of us, when we think about medical centers, when we think about student health, we think, of course, about confidentiality. And when we think about confidentiality in these contexts, we often think about HIPAA, because when you're thinking about medical information, you're thinking about HIPAA. But we need to be sure to understand that not all information that comes from a medical center is going to be protected by HIPAA. So HIPAA protects what is called protected health information, or PHI, which is individually identifiable information relating to the past, present, or future health status of an individual that is created, collected, or transmitted or maintained by a HIPAA-covered entity in relation to the provision of healthcare, payment for healthcare services, or used in healthcare operations. I think it's really important to note here, because a lot of people get hung up on this, that Clery does not require any personal information. So with regard to student health and EAPs, employee assistance programs, or any kind of Clery report, Clery reports can be made anonymously. And this is so significant that the ASR has to include any institutional policies or procedures for victims or witnesses to report Clery crimes on a voluntary, confidential basis for inclusion in the annual disclosure of crime statistics. So if someone comes to you on your campus and says, I was assaulted, even if the person says, and I don't want this investigated, I don't want anything to happen, you can still report that under Clery in your ASR without violating any confidentiality, even if it's something that happened in the context of a student medical center. Again, with regard to EAPs or counseling centers, pastoral and professional counselors are not CSAs, so they don't have an obligation to report. But if the school has procedures that encourage reporting, then that should be included in the ASR, meaning that the counselor, either pastoral or professional, has the ability to tell the person that they're counseling that the report could be included anonymously in the Clery crime statistics. So just because something happened in the context of a medical environment does not mean that it shouldn't be reported for Clery purposes, or that if it is, there is some sort of privacy violation. That's just, it's easy to get around confidentiality concerns. With regard to hospitals and medical centers, again, Clery reportable incidents likely do not involve personal health information. Incidents can be reported anonymously. Protecting confidentiality will generally not serve as an impediment to Clery compliance, and institutions should reassure affiliated hospitals and medical centers that sharing this information does not violate HIPAA or other privacy policies. That's something I'm going to talk a little bit more about as we move through this section about confidentiality. Is some of the things I'm going to be talking about relate to compliance, but other things that I'm going to be talking about relate to the relationship between the medical facility and the academic institution. And a good relationship and a clear relationship between the two entities is going to serve you well for all elements of compliance. So let's talk about another scenario. This is not a poll question scenario. This is just something that I want to throw out there and then discuss a little bit. So a patient arrives at a hospital's emergency room experiencing mental health issues, runs out of the emergency room and attacks someone violently in the parking lot that is shared by the hospital and the institution. This is witnessed by a hospital security guard. What should happen next? Now, this is going to touch on a lot of the things that we've talked about so far. Is the security guard a CSA? I think that we can assume that this happened on Clery property because it's a parking lot that they share. We'll assume that there's a written agreement for the sharing of the space or that the university is renting the space. Is the security guard a CSA? If so, does she know that she is, and has she been appropriately trained? If she is considered a CSA, she must report the attack to the institution, not just the hospital. And that's something that is going to be, that's why we would recommend, although as Haley pointed out, it's not required, that's why training can be so helpful. To whom do you make the report? If this is on Clery geography, and if she is a CSA, this is not information that just should stay within the hospital community. It needs to be reported to the institution so that the institution can take appropriate steps. The fact that a patient was involved does not implicate personal health information, so it's fine for this information to be shared. Then the institution would need to determine if the event is reportable. And another question is if the security guard is not a CSA, what should happen? Well, if she's not a CSA and no CSA finds out about it at the institution, then it's not going to be reportable. It's not going to show up in the Clery statistics. So that's why it's really important that the institution and the medical facility understand who are the CSAs. So some best practices here are to ensure that those working at the hospital and the medical center understand their Clery obligations. It's essential that they understand how the location is understood for Clery purposes and what their reporting obligations are, if any. It's important to impress upon the hospital and medical center staff the importance of sharing Clery information, even if it's not a regulatory obligation. The institution needs to be able to make a decision regarding whether or not something that needs to be reported. It's also just good practice for both entities to understand what's going on when it involves their students. You need to ensure that the institution follow up with the hospital or medical center staff about what happens with their reports. Again, this is not a compliance obligation. This is a best practice situation. We understood of a time where a hospital reported an incident to Clery, to the Department of Education, and said, you know, this didn't get handled the way it should. Well, the department came in. It turned out the incident had been handled appropriately, but there was no follow-up with the hospital to let them know that. And then it's important to convey that sharing information likely does not implicate confidentiality, and so it's fine to share this information between the two entities. Timely warnings, we also don't have to worry about confidentiality there either. Institutions must understand that they may be required to make a timely warning, issue a timely warning for an event that takes place at a hospital or a medical center. If there was a Clery crime that occurred on Clery geography that's reported to a CSA that represents an ongoing threat to students and employees, then a timely warning must be issued as soon as the information is available. So the institution can get itself into a bit of a bind if it doesn't get the information quickly. So that's why you need to be sure that both entities understand what their obligations are. Yes, an institution should make it clear to hospitals and medical centers that a timely warning must withhold as confidential the names and other identifying information of victims, and thus there are not concerns about reporting events to institutions in that regard. Excuse me. And now, you know, for FERPA, I don't think you can have a higher ed webinar without at least briefly mentioning FERPA. I don't think that there are really serious FERPA implications here, but it is worth mentioning that hospital and medical center employees may be considered school officials for purposes of FERPA if they perform an institutional service or function for which the institution would otherwise use employees, or under the direct control of the institution with respect to the use and maintenance of education records, and are subject to the requirements governing the use and redisclosure of personally identifiable information from education records. This may allow institutions to share student information with certain hospital personnel, but this likely won't impact the institution's Clery reporting obligations. Haley, back to you.
Yeah, I think we're out of time, but let's look ahead quickly. So as we look ahead quickly, remember your ASR, of course, and all the elements are still required for the ASR, and that includes the policy statements that we've talked about before that need to be included. And specifically, we didn't talk about it during this webinar because we didn't have time, but the VAWA policy statements, Violence Against Women Act policy statements, and that it is your current policy. So if you are making changes to your Title IX policies, to any other policies this summer, that's what needs to be included in your ASR. It is not the policies that were in effect when the crimes occurred. That would be very confusing with the 3 reporting years. It's the current policies, and people make that very simple mistake quite often. And then also remember, one of the most frequent areas that people get fines for are their drug and alcohol reporting policies, and the fact that they haven't completed their biennial review. And with COVID, that's something that could easily slip off the radar. It's got to be done every 2 years, but you have to look over your drug and alcohol policies every 2 years and make changes. So remember those things as well. And then, as Ellen went over in great detail, remember your Clery geography and make sure you're designating hospitals or medical centers, how they're considered within your Clery geography. We, again, really recommend as a best practice, not required, to have a map and to have, a listing of what you're including specifically in the non-campus area of your Clery geography. Make sure you designate your CSAs. I know a lot of people have struggled with that, and I will say that the freedom with the CSAs, and this came from one question on my presentation, was, we struggle with, the question was specifically about volunteers. Do volunteers now still have to be identified? Under what has been given by the department now, the guidance that's been given, the answer would be no, and not volunteers, because they're not going to have the significant and regular interaction with students in those particular areas that are identified in the regulations. I mean, I can't think of a volunteer that would have those significant and regular interactions with students. So you don't have to rely on the handbook if you don't want to, but it's a safe harbor if you decide to rely on the handbook. Again, we think training is a best practice. I got one question about training. You need to make sure, it doesn't have to be long, but you need to identify what they need to report, where they need to report it, how timely they need to report it, and how they need to document those reports. Those 4 elements in training are really important, and you can convey that in whatever the best manner that you think is appropriate at your campus. And then make sure that you're working with your hospitals and medical centers, that they understand their geography as well, and as Ellen just talked about, reassure them regarding confidentiality. So we had about 25 questions. I don't think we're going to have time for them. Ellen, was there anything else from your geography piece that you got questions about that you wanted to add to this before we end the webinar? I know we're already over.
One thing that a couple people asked about was, is there danger in over-reporting? Say you report something that didn't occur on your Clery geography. And Haley, you can correct me if I'm wrong, but my understanding is, yes, there is danger in over-reporting. The department doesn't want you to over or under-report. So I don't think that there is a general rule, when in doubt, report it. I think when in doubt, look into it, make a determination, and document it very carefully. Haley, would you agree?
Yes, I would, and in fact, specifically, we've seen one of our institutions that was going through an audit got into a lot of trouble for over-reporting drug and alcohol violations on campus, and the fact they were pulling from a software system drug and alcohol numbers, and a lot of them did not, they were violations of policy, but they were not violations of the law. And so there was an issue regarding that over-reporting. So you can get in trouble for over-reporting as well, and it's not just something, oh, we'll just, just throw it all in. We'll throw the kitchen sink in and then we can't get in trouble. That's not how these audits have gone, honestly. And anyone who's been through an audit, again, the Clery auditors are very, very nice people, but they're looking for issues. I mean, they are looking to identify issues in these particular audits. So it is not something with get a pat on the back trying your best. That's not really what's going on right now. So, but I'm sorry we didn't have time for all of the questions. We will try to get back to you if we can on your specific question. I want to thank everyone for joining us today. We hope this information has been helpful. As a reminder, this program has been approved for continuing legal education credit, so make sure you click on the CEU icon at the bottom of your screen. You'll get a certificate for attending this webinar and the course numbers tomorrow in an email, along with the recording of the webinar that you can view and feel free to pass along others that maybe missed it today on your campus. And be sure to complete our short survey so we can have other webinars that are timely to what you're dealing with on your campuses. So thank you again for attending, Ellen. Thank you very much for your help in today's presentation, and this concludes our webinar.